Hey guys, I'm Sarah Lavonne and welcome back to my YouTube channel. I'm actually on my phone really quickly here because I just went live with GoldiLacts, the Candaces. It's Candace and Candace from GoldiLacts, and they are our breastfeeding experts. I recommend them in any breastfeeding video I do. They service all of my clients. They have in-home and virtual services for lactation, anything breastfeeding that you need, and are live. To me, I learned so much and it was so insightful. I saw all the comments that have been coming in on it, and so I'm just so excited that we got to do that. But one of the questions that I asked in that live was all about tongue ties. And I feel like the conversation that we had was so helpful that I wanted to pull it out and save it as its own video because that live was like 55 minutes. And so here is, without further ado, the little snippet of our conversation about tongue ties, and I hope you find it super helpful. Candace.
Which one?
Direction. I know, right?
Me?
I'm like, and over Candace Nicole. I know this one you're gonna get really excited about because this is the hot topic one. I know. I like.
Is it sex or what?
Exactly. I'm like getting sexy vibes.
Exactly what I was thinking. I'm like, is this about sex and breastfeeding?
And you're the one. You're the one,
Sarah. Okay.
No, but I did. I got sexy vibes for myself too. I'm like, and I'm setting this up very weird, especially when you find out what I'm about to ask you.
Oh,
so one of the hot topic ones that is, first of all, not only a hot topic in breastfeeding, but also in pediatrics is
yes.
tongue. And so,
oh yeah,
that's sexy for you. And
yeah.
I want to ask about tongue tie, and this could be like a whole session. I'm sure it's an entire YouTube video. And so just to touch on it quickly, because everybody talks about it now and people are worried if they have latch issues, do I have a tongue tie? So if there is somebody out there that is like, maybe I have a tongue tie. Do I have a tongue tie? How would somebody be alerted to, maybe my baby has a tongue tie? I don't know if you know this, but the instance of tongue tie, like how prominent is it? How much are you seeing? And that could just be in your own practice, like anecdotally. And what would be the response?
I would say that 2 out of 3 babies that I see have some sort of oral tie issue. It's very, very common, and that's why it's become such a hot topic, because we finally have ways to address it and revise it and make breastfeeding more comfortable, as well as make connections to further developmental issues and speech issues. So a lot of times body work and chiropractic work and craniosacral therapy and speech therapy will all accompany the treatment of an oral tie for an infant.
And by oral tie, describe what you mean by that. Because I say tongue tie, that's what people say.
That's what people say because that's the most common. So tongue tie is typically what your pediatrician is looking for, but it is not the only type of oral tie a baby can have. We have frenulum all over our body. They are thin pieces of tissue that are connected to different muscle groups. Yes.
There you go.
So Sarah, yeah, you have a thick one too.
What?
Okay.
Is that good?
Yeah. It's good now and you don't have to breastfeed, so it's fine. I wouldn't worry about it. But
I didn't have issues breastfeeding.
You can also have them up here. You can have a thick upper lip tie. Go ahead.
There it is.
Yes. Yours looks good.
I'm not showing y'all my ties. I'm not doing it.
Mine's really thick. You can have them under here. That one.
Oh yeah.
Yeah. You can also, what people don't realize is that you can have buckle ties inside of your cheeks.
I did not know
that.
So
a baby who was born early and maybe doesn't have fully developed sucking pads on the inside of their cheeks can have buckle ties and other restrictions in this area. You could also have posterior tongue ties, which are underneath the back of the tongue.
I didn't know that.
So during a consultation, I wouldn't even be able to see that. You would have to go in. But that's when it takes a very educated and knowledgeable lactation consultant who knows the symptoms of those types of ties, so that if I suspect or Candace suspects any of this other type of behavior going on that is synonymous with a posterior or buccal tie restriction, we can send you in to be thoroughly oral examination. So we do have referral sources for that, but I get super geeked out over ties because I want to really explore every single baby's mouth that I look at, because I want moms to understand that sometimes you can have breastfeeding issues such as sleepy baby at the breast, fussy baby, extra gassy baby, very short feedings, not adequate weight gain. All of those are symptoms of tie issues. So if we have a mom
I had from like last month, and I'm like, maybe that was her issue. Shoot.
Yes. And we will run the gamut with these mamas. We will go over every single breastfeeding solution we can think of, and they are just super resistant to going in and getting this appointment. And then finally they'll give in and they'll go and see somebody and they'll be like, you were right. Posterior tongue tie, or, whatever, we got it revised, breastfeeding so much more comfortable. So I also want to reiterate, like, mama, you don't know what baby you're about to give birth to. We don't know if any of this stuff is going to exist until baby is here and we have the combination of this baby with your breast, this mouth on your nipple. So it doesn't matter how your first journey was. We don't know who you're giving birth to this time. Okay. It's completely different. Yep. So I want to be able to check for all of these things and make sure that you're seeing the right specialists and getting the thorough examinations that you need from these specialists, because I can help you breastfeed all we want. But if you stick with breastfeeding a baby who has this tie, you might also have a toddler who can't talk. And that's what happened with my son. He had an upper lip tie. I didn't even think to get him checked until he was 5.5 months old. Got him checked, decided not to do anything about it because he was 5.5 months old. And at 1.5, 2 years old,
in theory,
we were breastfeeding fine. Everything was comfortable. But at 1.5, 2 years old, we were told that he had a major speech delay. We were in speech therapy, not knowing what was wrong. He had a bunch of other health concerns, went in for oral surgery. He had a bunch of stuff going on in his mouth that maybe could have been corrected early on. And we could have avoided a lot of stuff. He's fine now. And it doesn't mean that every baby with an oral tie issue is going to have those same health concerns or that speech delay. But in my opinion, go in and get the information. Go in and talk to the specialist. They're going to a pediatric dentist. They're going who specializes in frenectomy procedures. Okay. You can't just go to any pediatric dentist. You have to make sure that they have the equipment and the knowledge necessary and the training, their specific training that they take to become more knowledgeable about this in order to provide this service for the revision procedures. They're going to a pediatric dentist, a pediatric ENT. They're going to a pediatric frenectomy specialist. We work with some amazing people who are very consultation based. You go in, they look at your baby, they let you know what you're working with. They let you know if they think it's going to be a major concern down the road, or if they think you could just power nurse right through it if it's not going to be an issue. It doesn't mean that anything needs to be done, but what you'll be provided with is the peace of mind of knowing what's going on with your baby, and you won't be sitting at home thinking that it's your fault that breastfeeding is not comfortable, or that baby's not gaining weight fast enough, or they don't seem comfortable at the breast. It must be me. It's not always. It's not. So the reason why it's such a hot topic is because it's so freaking common. And now we have the research and the tools and the technology to do these revision procedures in an instant. And it's virtually painless to the baby. They start healing immediately after. You get breast milk in there with all its yummy antibodies and stuff in there, healing it immediately. You do a couple weeks of exercises to make sure it's healing properly, and then you're done and you move on your merry breastfeeding way. It's so worth it.
It's not like major surgery or something. It's literally like
it's not,
and you're done.
The quick laser.
Topical anesthesia, just like when you go in to get your teeth cleaned, they take a water laser, they zzz right across it. Wherever it is in the mouth, the skin starts healing immediately. We work with amazing professionals who literally let us be in there and hold your baby while they're getting it done. They don't want you in the room because it's going to freak you out, but they'll let us be in there. And then we literally just walk your baby to you and you latch. And it's like, I've had moms just cry, like, this was it. This was the thing. This is what, and it's like, they're on their way now. That's just what we needed to do. It's just a thing, you know, it's just a thing. Yep. So just go in and get the information. Yeah.
I have a fun fact about ties for you guys is that if your baby sleeps with their mouth open, they might have a tie. And so this goes for bottle feeding as well. Tie things aren't only an issue for breastfeeding. They can cause issue for sleep. They can cause a host of other issues like Candace Nicole was talking about. And they can even cause pain in their shoulders or neck and lead to a fussy baby, a bottle formula fed baby. This can happen. What happens is it's very, very tight in there and they have to overcompensate to eat. So things get very, very tense. So a lot of times, like Candace Nicole is saying, infant Cairo and those type of things kind of go hand in hand with ties. But even if you're not breastfeeding, even if you're formula and bottle feeding, ties are something to make sure that you don't have an issue with, for sure.
That's a really good point. I like to always, you know, reiterate that these frenulum are attached to different muscle groups, which are then attached to different muscle groups. So you may have a baby who has a posterior tongue tie or buccal tie restriction, and they favor one side of their neck, or they can't move their trunk the entire way, or, you know, and sometimes those problems are exacerbated as they get older. My son had sleep apnea because he had to sleep with his mouth open, and he ended up not being able to breathe very well when he was sleeping. And that was my first tip of like, something needs to be done. And we ended up finding out that his upper lip tie was attached to a muscle further back in his throat, which was straight, that should have been curved, and that was restricting his breathing. So you just never know, you know, you never know what's going on in there.
I'm learning a lot about this piece. In fact, I think I'm going to probably cut this and make it its own video on my channel, because this tongue tie stuff, I mean, I know it's an issue and I have like a baseline level of knowledge, but there's so much about this that I feel like is so helpful for people, because I think it in my mind of what I hear is that you have a tongue tie, you usually have milk latch issues and milk supply issues. And it's such a bigger issue. And the other thing is, for everyone, it's so common. It's not like
so common
with you, or there was some sort of developmental issue that you didn't give your baby the nutrients to make less tight ties in their mouth. And
it's nothing that you did.
It's nothing that you did. The reason why breast milk rates have been lower in the past, simply because mamas just know that this hurts, it's not working, they're not making enough milk, what the heck, could be all tie related.
So helpful. Thank you guys so much for being with me. I hope you found that little conversation really helpful. Hopefully, if maybe you're struggling with breastfeeding or you're having any of these other issues, go see your pediatric dentist that specializes in frenulectomies. Everything will be in the description box down below for all those little tips, because I know when we use big words like that, it can feel overwhelming. If you want more from me, you can head on over to bundlebirth.com. I have childbirth classes over there, virtual support, all the things. Anything else you need, you can find over at BundleBirth. Make sure you follow me on Instagram, because there's lots more coming over there. Make sure you follow GoldiLacts on Instagram, and then their website for their breastfeeding prep classes and any other support that you might need for literally anyone, anywhere, is in the description box down below. And then don't forget to flex and flow, and I will see you soon.